Okay, good morning, everyone. Welcome to our presentation on the population assessment of tobacco and health study, a longitudinal cohort study of tobacco use, its determinants, and its impacts. As Linda stated, my name is Kaye Marz. I'm the Senior Data Project Manager for the National Addiction and HIV Data Archive Program at ICPSR. NADAP staff curate the past study data from ICPSR. This is the first in a series of sessions throughout today that are presenting on various aspects of data transparency. We hope that you are able to attend the other sessions today in the ICPSR Data Fair. First, let's define what data transparency means for this session, which is focused on the world of data sharing. The first component of our definition is reliability and transparency of content. Data users are confident that the data they are using are accurate and were provided by permission from the cited source. And secondly, ease of access. Data users can easily access and work with the data no matter where they are located or the method or technology used to create the data. Let's look specifically at our case study, which is, again, the population assessment of tobacco and health study. Although the past study is a complex data collection effort, features of this study and how it is sharing the data can be used as a model to prepare and share data from other research. In 2009, the Tobacco Control Act gave the Food and Drug Administration, the FDA, the authority to regulate the manufacture, distribution, and marketing of tobacco products to protect public health. The past study was launched in 2011 to monitor and assess tobacco use, its determinants, and its impacts in order to inform FDA regulatory activities. The past study is a nationally representative longitudinal study of tobacco use that is designed to support the FDA's Center for Tobacco Products regulatory considerations. The study is funded by the FDA and administered by NIDA, the National Institute on Drug Abuse. Westat holds the contract to implement the past study work plan, and they have 9 scientific partners to support this mission, as shown on this slide. The past study, again, uses a longitudinal cohort design with a nationally representative sample of the U.S. population drawn using a stratified probability design that started at wave 1 with nearly 46,000 persons aged 12 years and older, including over 13,000 youth. Importantly, the sample includes never, current, and former tobacco users. Adult tobacco users and young adults were heavily oversampled, and there is a modest oversample for African American adults. A CASI was used for the interviews, and adults also provided biospecimens. Perhaps the most distinguishing feature of the past study is its longitudinal nature, which complements the cross-sectional tobacco surveillance systems that were already in place. This design allows researchers to examine changes in tobacco use behavior and health outcomes over time. Shown on this slide is just a sample of some of the outcomes that can be examined with the past study data. Another distinguishing feature of the past study is the very detailed questions about use of specific tobacco products: first-time use, current use, amount used and purchased, new product uses, switching between products, and dual and poly use. Generic images of the product displayed on the interview screen when selected questions were asked about that type of tobacco product, except for cigarettes. Some tobacco products come in a variety of subtypes. For example, cigars include traditional cigars, cigarillos, and filtered cigars. Product descriptions emphasize the physical features that differentiated the cigar types. Available from the past study are 2 main types of data: questionnaire data in 2 versions, public use files, are downloadable from the NODAP website after the data user agrees to the online terms of use, and restricted use files that are accessed only via the ICPSR Data Enclave and require a signed data use agreement and approved application. Biomarker data are also available from the urine and blood collections. These are available as restricted use files only. Typically, they are identified with the BRUF acronym, and access similarly requires the signed data use agreement and approved application. So how does the PASS study promote data transparency? Remember the two types of data transparency in our earlier definition: reliability and transparency of content, and ease of access. First, we will cover how the PASS study exemplifies the principle of reliability and transparency of content. Reliability and transparency of content are present in three main ways, each of which will be expanded upon in the following slides. First, the data source. Familiarity with a source of data is always important for assessing its reliability. The PASS study design was based on a validated model, and the questionnaire items were adapted from other well-established surveys. The PASS study data are collected with the involvement of two government agencies that have knowledge of research and substance use issues. These agencies are openly sharing the data, so research can be done to inform the FDA regulatory activities. For documentation, the PASS study data are accompanied by extensive study level and dataset level documentation. And for other resources, the PASS study provides resources for workshops to train data users to appropriately analyze the data, and a data users forum and support staff to answer users' questions. So elaborating on the first facet of reliability and transparency, the data source. The PASS study is a model in development of its study design and questionnaires, an emphasis on consistency and standards to foster collaborative research. The PASS study design is based on the host agent vector environment conceptual model that has been validated in assessing the impact of several tobacco control policy interventions. Many of the PASS study questionnaire items were adapted from well-established existing national surveys and included items from international, state, and privately funded tobacco surveillance surveys. And again, images of tobacco products were used to help the respondent identify which products they used, as was extensive use of tailored question wording based on responses to previous items. As mentioned earlier, the PASS study is funded by the FDA and administered by NIDA. Their involvement provides consistency and standards for quality and accuracy, especially knowing that the sharing of the data encourages collaborative research and extensive use that increases scrutiny of the data. Finally, studies like the PASS study reinforce positive relationships between government funders and the research community, increasing the potential for other similar collaborations in the future. The second facet of reliability and transparency demonstrated by the PASS study is the nature of documentation available. The PASS study team has documented all aspects of the data that they believe data users need to know to use the data correctly. The previous slide listed several types of study-level documentation. Here I'm highlighting the user guides. There's one each for each version of the data, as their content can be used as a model for the development of other user guides. So their user guides contain information about the study design, background, sample design, data collection procedures, response rates, and more. Information about weights and imputation, structure of the data, variable naming and codes, and information on linking of files and example code for popular statistics. For the dataset level documentation, I'm highlighting their annotated questionnaires. Their ask and skip statements identify who answered each question. And the explanatory notes, such as display notes and program notes, and the algorithms show how information was presented to the participant and additional information on how to interpret the variable. The past study funding also supports resources for data users. In the past 3 years, we have had a summer workshop, each free of charge, to researchers who wanted to learn more about using the data. Webinars and workshops on specific datasets or groups of datasets can be an option, so contact NADIP if you are interested. A number of online resources are available about the past study, including the past study data user forum. This is a platform where researchers can discuss questions with other users as well as receive answers directly from NADIP staff. And support is also provided to data users by NADIP staff who are available to answer questions about the data and to assist with applying for access to the restricted use files. The other principle of data transparency that the PATH study embodies is that of ease of access. I will discuss two main components. First is availability of information. It's best to be clear how data can be accessed and by whom. As mentioned before, the PATH study data are available as public use and restricted use files. No access fees are charged to use the PATH study data. Most federally funded data can be downloaded without a fee, as costs can decrease the transparency of data by limiting who can use the data. The PATH study team also provides support for access to the ICPSR Virtual Data Enclave, so the RUF and BRUF users, those using the restricted use data, don't pay the annual VDE license fee. And one of the PATH study's greatest advantages is its support services, which include an online request system to apply for access to the restricted use data, other online resources, and support staff to answer user questions. It should always be easy to find information about the data itself, as well as information on how it can be accessed. The PATH study data are available as public use files, meaning that it can be downloaded directly from NADIP's website without first going through an application process. Still agreeing to the online terms of use is required. The public use files can meet the needs of most researchers. The PATH study restricted use files are available to researchers who demonstrate a research need to access details not able to be in a public use file. For restricted use data, the online system walks users through all steps of the application process, and additional information is available in the online VDE guide. Finally, ease of access is promoted through readily available support services. The PATH study uses the ICPSR online system for users to apply for access to the PATH study restricted use data. Note that some application information also is sent via an email correspondence tracking system. The NADIP PATH study has its own series page with information specifically for researchers, and the RUF, PUF, and BRUF homepages and documentation that are available online even if the data are restricted use to provide extensive information about the study. Citations to publications that utilize the PATH study data are regularly added to the ICPSR bibliography so users can know about research already conducted with the PATH study data. The extensive variable detail in the PATH study questionnaires allows each variable's information to be searched and displayed on screen, as well as allows comparisons across other PATH study variables and other studies in ICPSR. And as always, NADIP staff are available to answer questions about accessing the data, including the application process, as well as any other questions about the PATH study data. We have covered how the PATH study, with the help of ICPSR, exemplifies the important principles of data transparency. It does set a high bar, especially with resources like workshops and support staff that may be beyond the means of a smaller study. But this does not mean that your data cannot be reliable and easy to access. You can also base your study design on known models and adapt questions from well-established surveys or other sources. You can provide dataset level, and variable level documentation sufficient for users to understand the data. You can also consider a public use version of the data if possible, even if a restricted use version is needed that has all the details, and the archive can help you with this. You can let ICPSR know about citations to publications based on use of your data. And contact NADAP if you're interested in a webinar or workshop to highlight your data, including with other data in NADAP on the same subject. Finally, it's organizations like ICPSR that provide the structure necessary for researchers to share their data in a transparent process, as well as ease of access to those data, whether public use or restricted use. In addition, ICPSR's resources promote data transparency through its reliable data storage, online resources, search tools, and training options, such as webinars and workshops, and our staff support to assist researchers with using our data. This type of organization allows the kind of access to studies that may not otherwise be possible, encouraging the transparent flow of data throughout the research community. And so if you want more information or if you have questions, we ask that you send questions about access to the past study restricted use files in ICPSR's virtual data enclave to our email address specifically for VDE support, which is nadap-vde-support@umich.edu. And we also encourage you to check out our VDE guide, which provides a lot of information about the application process and using the VDE. For other questions, please email us at our generic email address, nadap@icpsr.umich.edu. We encourage you to attend our 5 other data transparency sessions today, and just want to remind you that data sets in ICPSR can be used as a model to make your data transparent as you share it with others, that ICPSR is your official source for data obtained from the data's official source, and ICPSR provides easy access to data in a variety of standardized formats. So we can now turn to the questions that we have received. If you haven't done so yet and you have questions, please go ahead and submit any questions that you have, and we will work to answer each one. Have you had any surprising findings? Can you elaborate on your question a little bit? And while you're doing that, I think I'll go ahead and answer another question. So my study is not as complex as the past study. What information would I want to provide and share for a study that's less complex? So we typically would like researchers to give us a good description of their study. There's 3 main things that we ask for: a good description of your study, why it was done, the design, so who was interviewed, information about the sample, the dates of collection. That information can be provided to us through the deposit form, which has fields where you can enter all of the information that we typically display in a study description on our website. If you have a journal article or other document that also has that information, you can simply just upload that document with your deposit form. Regarding the data and documentation, we would like to have the data deposited that has full labeling, complete variable labels and value labels, and also missing values declared, or at least a legend on missing values, so that we will know to prepare and inform other data users which are the missing values. And then also we would want the original data collection instrument, whether that's a survey form or maybe a form that was used to abstract from records, information that shows how each of the variables was conceptualized. So with those 3 items, we can go a long way. And if we receive those and we still have questions, then we will contact you for more information. So, oh, I'm sorry. I will repeat the question before answering. Thank you for the reminder. So another question is, how do I know if a public use version of my data can be made available? Sometimes data contains such confidential information and detailed information it would not be possible, but there are times where just limiting some variables can lead to coarsening the data enough that a public use version can be made. So one step is to limit geography, or if there's continuous variables like age, to make those into categories, or to top code variables. If you have a data set that you feel would be best restricted use and you also are interested in a public use version, please go ahead and contact us. You can send your documentation to us in advance, even in advance of depositing the data. So it could be your instrument or a data collection, a data dictionary, and we'll take a look at that and give some recommendations on how we think we could make a public use file. So what are the practical ways and means one could use to effectively engage African policymakers and National Institute of Statistics in the move of data transparency and sharing? This is a pressing issue because it's difficult for African researchers to access data. I think one that comes to mind is to look for models that can be given to these policymakers to show how data can be shared transparently, and then by giving them a way to know how it can be done, they might be more willing to adopt a model and make the data more available, because we agree we would like the data to be used. That's why the archive is here. So if there are other ways that it's difficult for African researchers to access data, you might go ahead and send us an email, and we can see if we can think more about ways to address those specific barriers. Has the study uncovered anything you were surprised by, or what has been your favorite part of working with PATH? I think one of the things with working with the PATH study is that it is really so extensive, and we know that it's obtaining very important information about an area that affects a lot of people's lives. So there are a lot of tobacco users. The field is changing in tobacco product use. Even people who are not smokers are often affected by the use of tobacco products by others. So it just is really great to be involved in making this type of data available. I think in looking at the publications, there are really quite interesting things that are being found with the data, and I encourage people to go to the bibliography that's available from the PATH Study Series page and take a look at those publications, because then you can find out, what's being found with the data. And we have one more question here. I like the idea of using existing validated scales for my study. Where can I find them? So I think one option would be for your field is to read publications and other research that's been done. Oftentimes they will identify instruments that they used for collecting their data. And then you can Google those scales and find out how you can also obtain them. I'd like to take this opportunity to mention that the past study questionnaires are not copyrighted by agreement and way that the study was designed. So the questions can be used for other research. They can be adapted for other research without permission and without paying any fee. They do request that people cite that if you have adapted from the questionnaire or used the questionnaire items, that you would cite that your questions did come from the past study. Also, a couple of resources are the National Institutes of Health have a common data elements project out there. The National Library of Medicine is hosting the CDE repository, and these are where they're encouraging researchers to use the same questions for their studies that are being used with other studies. So there's comparability across studies. So if you Google NLM space CDE for the National Library of Medicine, Common Data Elements, that will connect you with this CDE repository. And NIH is also, they also have the Phoenix Toolkit, which is capital P, lower H-E-N, capital X, Phoenix Toolkit. And that also similarly is requesting and encouraging researchers to use the same questions across in their research that are being used in other research. So we can build a body of comparable data that can be compared across studies on the same topic. So we have time for a few more questions. Okay, well, I don't see any more questions, but again, you can always email us if you come up with questions afterwards. As Linda mentioned, the slides and the video will be available on our YouTube channel, so you can then get our email addresses, and feel free to email us at any time. And so I think at this point, we will conclude the webinar.